Hello, it's Bruce Williams, and today I'm going to do hopefully a short part 9 on the 10-part series of the pathology of the domestic ferret as we get into the musculoskeletal system and finish up with the integumentary system. Most of the diseases that we see in these systems are tumors. But in part 9, we're going to cover the musculoskeletal system of the ferret. As I do before all of my lectures, I want to thank those folks who have given me images over the years and allowed me to put these lectures together. The first and most common musculoskeletal tumor of the ferret is usually seen at the end of the tail, like this. This picture always reminds me of a ferret who's trying to find the bass drum to play in the band because he has a large bald bulb at the end of the tail. This is a common tumor in ferrets, which may be seen anywhere in the spine, but most often, luckily for us, is found at the tip of the tail, and these are known as chordomas. Here's another image where the skin is reflected, and you can see this hard ball at the end of the tail. And the ball is composed of proliferating bone and cartilage. This particular neoplasm arises from primitive notochord. Notochord really doesn't have any job in the mature animal, but during development, it forms and covers the skeleton, which turns into the spinal column, actually forming the vertebra of the spinal body. So it does know how to make cartilage, and it knows how to make bone. After all the bones and cartilage are formed of the spine, there is no purpose for it. The vast majority of it disappears. In ferrets and mice and people, the species most commonly affected with chordoma, you may find little rests of notochord within the intervertebral discs in the nucleus pulposus, which stay through life and hopefully don't ever do anything. But unfortunately, in some individuals, they get turned on and believe that they have to start making a new spinal column and produce cartilage and bone again. As I said before, most of them are found at the tail tip, but some unfortunately are found in other areas of the skeleton. The cervical vertebra are the second most common in the area of C1 and C2, and you can see there is the outline of a large mass which is ventrally displacing the trachea. And you can see these small areas of bone density, which looks like the ferret has swallowed a bag of gravel. But actually, this is bone that has been produced by the tumor. It's a very characteristic appearance and one that you probably will not miss. Chordomas are low-grade malignancies. They don't tend to metastasize anywhere, but they are extremely locally invasive. And when they arise in the area of a vertebral body, they will quickly replace that vertebra with proliferating areas of cartilage, and centrally there is bone. This is a cervical vertebra from an affected ferret. Here are the wings of the vertebra out here, which contain bone marrow as a normal finding. Here is the body of the vertebra, the ventral body here, and the spinal cord. It is very difficult to make out the dorsal vertebra, and the spine is gone because it has been replaced by this proliferating neoplasm, which cuts through it like a knife through butter. When these tumors appear at the end of the tail, it's really not a problem. We just amputate the end of the tail. Unfortunately, if they pop up in the cervical vertebra, for that matter, any other vertebra in the body, they cause a tremendous amount of damage, inevitably resulting in fracture of the vertebra, damage to the spinal cord, and severe paresis or paralysis. At the end of the tail, they have a good prognosis. Anywhere else, they have a poor prognosis. So that's chordoma. Flat bones of the skull will develop neoplasms as well. We covered the jaws in the lecture on the upper GI tract. And squamous cell carcinoma is the most common tumor of the jaws in this species because it rises from the epithelium which lines the sockets that the gums live in. When we talk about the remainder of the bones of the skull, the most common tumor are osteomas. These are benign tumors. They are hard. They're generally attached by either a narrow or a broad stalk to the flat bones of the skull, including the cranium as seen here. They grow very slowly. Here's probably my favorite picture the owner ever took, because it really took a tremendous amount of guts to lay your recently deceased ferret out, open its head, and dig down to the osteoma, which had previously been radiographically identified. You can always tell an osteoma. They're extremely bright bone density because they are lamellar bone which is grown over a long period of time. So it really is a chance to get nice and dense. Rapidly growing bone tumors don't achieve this type of density. But here we can see the osteoma. And I'm a big fan of identifying these particular tumors very early. They're benign. You can go in often with a bone chisel and chisel them off. Now, chances are they may regrow, but you've bought the animal a much longer period. Here's Beanie Boy. Beanie Boy had an osteoma on the side of the face, which was relatively easy to get to, but Beanie Boy's vet wasn't very confident in his ability to work on ferrets, and they decided, because it was slow growing, to just continue to let it grow. A year and a half later, here's Beanie Boy again, and any chance that we would have to remove that bone, which is now deforming the face, is long gone. So if it is an osteoma of the head, surgical approaches are certainly recommended to remove these tumors. When we talk about the long bones, we do have a higher incidence of osteosarcomas, as we would expect with other species. You can also see osteosarcomas on flat bones as well, but the majority of them pop up in the long bones of the legs. And here's a very large osteosarcoma from an amputation specimen submitted by Mike Garner, and this animal went on to do quite well. Ferrets do excellently when the legs are removed for the development of neoplasms. They're light creatures, they balance very well, and I would never not do surgery on one of these. They don't tend to metastasize with the frequency that we see it in the dog. And so an animal with an osteosarcoma of one of the legs deserves that chance to see if we can pull it through. Here is another osteosarcoma, this one from one of the lumbar vertebra. And I never did see a picture of this animal. This was sent to me as a surgical biopsy. And with Photoshop, I was able to outline the thoracic vertebra. And you can see this tremendous neoplasm. I have no idea what this animal looked like, but this tremendous neoplasm arising off the flat bone of the vertebra. You can see where it's within the cortex, and it's broken out of the cortex and grown along the side of the body. I really would have liked to have seen a gross picture of this animal. The vast majority of what we see in the bones of the ferret are neoplastic disease, but here is a very famous ferret who was the mascot of the Ontario Ferret Society for many years. His name was Harley Bug, owned by Ms. Randy Belair, and for the last 4 years of his life, he had a chronic infection of the bone of the eye socket, which was caused by nocardia. Nocardia and actinomyces are very similar bacteria that tend to infect the bone through trauma and inoculation. If an animal is eating rough feed and punctures the mucosa, or it, like ferrets like to do, is investigating its environment with its mouth and pokes through the mucosa. These two bacteria are commonly seen within the oral cavity as commensals, and once inoculated into the soft tissues around the mouth, they will form a granulomatous inflammation that is the dickens to ever get rid of. Harley will go into the vet twice a year to have inflammatory tissue debrided out of his eye socket. He lost his eye on the first visit, but he was always a happy, healthy, and rambunctious little guy up until he died of unrelated causes. So it's a tremendous commitment to keeping this guy healthy, and he was adopted by a lot of people at the Ontario Ferret Society, and I had the opportunity to meet him one day in Canada. So you will see this. We've seen a number of these in ferrets, these higher bacterial infections. They're deep-seated granulomatous infections of the bone, and they won't kill the animal. They don't tend to go to any critical structures. They just get into the bone, and they are very happy to live there for the lifespan of the ferret. Well, that covers the musculoskeletal system. Please come back for the 10th and last installment of this series, where we'll talk about diseases of the integumentary system. Have a great day.